Welcome to the podcast. I'm excited to have you join me today. If you're a mental health professional, counselor, or therapist, you're in the right place. Today's episode is a companion to the 2 CE Hours Health Equity Training course offered by Therapy Trainings. This course dives deep into the critical topic of health equity, a subject that affects the way we provide care and interact with our clients. In this episode, we'll explore several key points from the course, discuss the importance of health equity in mental health, and even tackle some common misconceptions surrounding this topic. By the end of our time together, I hope you'll walk away with a deeper understanding of health equity, why it matters, and how you can integrate these insights into your practice. So let's get started. First off, what exactly is health equity? Simply put, health equity means that everyone has a fair and just opportunity to be as healthy as possible. It's not just about access to healthcare. It encompasses a variety of factors, including social determinants of health, systemic barriers, and individual circumstances. It's about ensuring that all individuals, regardless of their background, have an equal chance to achieve optimal health outcomes. Now, why should we as mental health professionals care about health equity? The answer is multifaceted. Research shows that health disparities, differences in health outcomes between different population groups, are prevalent. These disparities can be rooted in social, economic, and environmental disadvantages. For instance, individuals from marginalized communities often face greater challenges, such as limited access to mental health services, stigma surrounding mental illness, and a lack of culturally competent care. Understanding these disparities is crucial for us to provide the best care possible. When we recognize the systemic issues that contribute to health inequities, we can tailor our approaches to meet the unique needs of our clients. This course emphasizes that awareness is the first step towards meaningful change. One of the first key points we covered is the role of social determinants of health. These are the conditions in which people are born, grow, live, work, and age. They shape our health outcomes and can either promote well-being or contribute to health disparities. For example, consider a client who comes from a low-income neighborhood with limited access to mental health services. They may not only face economic hardships, but also live in an environment that lacks supportive resources. As mental health providers, it's essential we look beyond the individual and consider these broader social factors. Integrating this perspective into our practice can enhance our understanding of a client's situation and inform our treatment strategies. Next, let's talk about implicit bias. This is another topic we explored in the course. Implicit biases are attitudes or stereotypes that affect our understanding, actions, and decisions unconsciously. They can influence how we perceive our clients and the care we provide. For instance, if we unconsciously associate certain behaviors or traits with specific racial or ethnic groups, it could lead to misdiagnosis or inadequate treatment. Being aware of our own implicit biases is a critical step. It's not about blaming ourselves. Rather, it's about recognizing that we are all human and subject to these biases. The course encourages us to engage in self-reflection and seek out training opportunities to minimize the impact of these biases in our practice. Now, let's address some common misconceptions surrounding health equity. One prevalent myth is that health equity is solely about healthcare access. While access is certainly a significant component, health equity encompasses much more than that. It's also about the quality of care received, the experiences of patients within the healthcare system, and the socioeconomic factors that the care affect health outcomes. Another misconception is that achieving health equity is only the responsibility of policymakers or large organizations. In reality, every one of us has a role to play. Whether you are working in a private practice, a community clinic, or a hospital, you can advocate for your clients and work to create a more equitable environment. It's essential to recognize how our actions, big or small, can contribute to this movement. For example, you might consider offering sliding scale fees for clients who are financially disadvantaged or becoming involved in community advocacy initiatives. Every step counts. Let's pivot now to a vital topic: cultural competence. Cultural competence is the ability to understand, appreciate, and interact with people from cultures or belief systems different from your own. In the context of health equity, cultural competence is a crucial skill that can enhance our therapeutic relationships. In the course, we discussed strategies for developing cultural competence. This includes actively seeking to understand your client's cultural backgrounds and being open to learning from their experiences. It's about recognizing the unique challenges they face and validating their narratives. For instance, if a client expresses a hesitancy to engage with mental health services due to cultural stigma, it's our job to listen and understand that context. Building trust is paramount, and cultural competence can be a bridge to establishing that trust. Now, let's delve into a real-world example to illustrate the importance of health equity in our practice. Picture a therapist working with a client who is a recent immigrant. This client may be dealing with trauma from their past, as well as the stress of adapting to a new country. If the therapist recognizes the impact of displacement and cultural adjustment on the client's mental health, they can approach treatment with sensitivity and understanding. This means not only validating the client's experiences, but also considering how societal factors such as discrimination and economic instability may be affecting their mental health. By integrating this perspective into their practice, the therapist can provide more effective and empathetic care. As we approach the conclusion of our discussion, I want to leave you with some thought-provoking insights. Health equity is not merely a buzzword. It's a fundamental principle that can shape the future of mental health care. By embracing this perspective, we can foster environments that promote healing and understanding for all clients. I encourage you to reflect on your own practice. How can you incorporate health equity principles into your work? Whether it's through education, self-reflection, or community engagement, every effort matters. As we wrap up, I'd like to remind you to visit therapytrainings.com for more courses that can enhance your professional development. The 2 CE Hours Health Equity Training course is just one of many valuable resources available to help you grow in your practice. Thank you for joining me today. I hope you found this episode insightful and that it inspires you to take action towards promoting health equity in your work. Remember, every conversation, every effort, and every ounce of awareness counts. Together, we can make a difference in the lives of our clients and contribute to a more equitable world. Until next time, take care and keep striving for positive change in mental health.